Hello, my name is Claire Oserall, and today I will be presenting with Abigail Midlich, Daniel Claiborne, and Shannon Brooks on our white paper topic, Access to Quality Maternal Health Care for Minority Women in Rural Areas of the United States. To start with our objectives, to discuss the background of maternal health care in the United States, to identify the measure of problem scope of maternal health care in rural compared to urban areas, focusing on minority women, to explain primary determinants to access to quality maternal health care for minority women in rural areas, to apply globalization to this population in the US, to discuss the priority interventions of access to holistic maternal health care and education, to assess recommendations and limitations to current literature and research in maternal health care, and lastly, to conclude the implications of current findings. Within the rural population of the United States, women have experienced many lapses of inadequate health care, especially in the area of maternal health. Improving maternal health and outcomes and closing the health and wellness gap for at-risk Native American, African American, and Latinx communities is a priority and is dire. Maternal health mortality rates in minority communities are disproportionately high. Data has shown in some parts of Mississippi, where roughly 40% of its population is composed of minorities, the rate of maternal death for women of color exceeded that of sub-Saharan Africa. Due to the inability to access quality maternal health care, minority women in rural communities are exposed to many adverse health outcomes, specifically looking at maternal mortality rates. To discuss measure of problem scope, census and health data collected by the CDC shows the maternal mortality prevalence in the US has increased between the years 2000 to 2016. By place of residence, rural areas showed 29.4 maternal deaths per 100,000 live births, compared to urban areas showing 18.2 maternal deaths per 100,000 live births. And lastly, looking at the same data by race, it is clear that African Americans have much higher prevalence of maternal deaths, looking at 42.4 maternal deaths per 100,000 live births. Same with an increase with American Indian, Alaska Native, non-Hispanic women. And lastly, Latinx women fared better than both other groups, but still experience a disproportionate maternal mortality in comparison to Caucasian women at 11.3 deaths per 100,000 live births.
Good evening, everyone. I will be discussing the determinants part of our white paper. So within the primary literature, we discovered that our population is fairly under-researched, even though they tend to have some of the highest amounts of maternal mortality. African American women, Latinx women, and Native American indigenous women are underserved. There has not been too much research put into how to address these issues, since international and national resources tend to go outside of this nation. Along with the patient's baseline literacy of maternal health and self-care, it is shown that age and educational attainment play big roles in a patient's ability to make the best choices for themselves and their infant, and seeing how there's not too much quality assessment to see whether their needs are being met. So for the second part of the determinants, one of the areas of investigation was distance from hospitals and how that impacts on travel time and the maternal outcome for the mother. For complicated and atypical pregnancies in which emergencies may arise, this can lead to negative health outcomes. Unfortunately, when local hospitals are unavailable, non-local hospitals become the primary option, especially when the local hospitals are also under-resourced, and this puts an undue burden on the mothers to get access to quality care. This also leans into why there are barriers to obstetrics care because of under-resourced areas, which lead to severe limitations on neonatal care and any opportunities for abnormality screening and preventative interventions for the mother's health to be addressed so that she can have a rather stable pregnancy. And in the end, it does boil down to some aspects of economics in which urban hospital systems are just able to outcompete those local hospital systems, and they have better retention of healthcare professionals, which leads to more ideal health outcomes. So, going into the socioeconomic framework, at the individual level, things such as the mental health of the mother and her partner's relationship as she's going through a pregnancy can affect postpartum depression and her ability to either pay attention to some of the resources available or the information that would be communicated to her from her doctors. Going into community support, for a lot of these rural areas, there is a very conservative mindset, which may limit the access to these healthcare services to women who are unwedded and also underage teen mothers. The federal level needs to make some changes concerning obstetrics referral systems so that in these rural areas they can find the healthcare services that they need.
Access to quality maternal health care is a global problem. In 2015, the United Nations released the Sustainable Development Goals and charged member nations to reduce the global maternal mortality ratio to less than 70 deaths per 100,000 live births by the year 2030. To do this, we must increase the number of births attended to by skilled health personnel. The US has met this goal, but when we compare the US maternal mortality rate with similarly developed nations, we can see that our country's maternal healthcare system requires significant improvements, despite the fact that the US spends more on healthcare per capita than other developed nations. There's a shortage of physicians in rural parts of the US that likely contributes to the disparities in maternal mortality ratios between urban and rural areas. Skilled healthcare workers are migrating from rural areas to urbanized areas because of the resources and opportunities offered. The lack of physicians available in rural areas decreases access to quality maternal health care for women living in these areas. There is a brain drain from rural to urban parts of the US. Research has showed that 3.57% of maternal mortality in the US is due to being in a rural environment. This statistic shows that addressing disparities between rural and urban populations could help significantly reduce maternal mortality in the US. Further, non-Hispanic Black, American Indian, Alaskan Native, and Hispanic women have 33% greater odds of maternal mortality than non-Hispanic white women in the US. Medicaid beneficiaries and those without health insurance have 30% greater odds of maternal mortality than those with private health insurance. These statistics represent that location, race, and socioeconomic status are significant determinants of maternal health across the US. Another determinant of maternal mortality is education status. This causal loop diagram shows the effect that education can have on maternal mortality. Education can increase maternal literacy, or a woman's knowledge of health basics, parenting, and the healthcare system. Increased maternal literacy increases a mother's health, hygiene, and nutrition habits, which in turn decrease the risk of complications during pregnancy. Education also decreases the risk of teenage pregnancies, which could lead to pregnancy complications. Complications during pregnancy can increase the risk that rural women need to travel to non-local hospitals to receive adequate care. Further, increased travel time to non-local hospitals increases the risk of complications during delivery. Both non-local delivery and pregnancy complications increases the risk of maternal mortality. This diagram demonstrates possible points of intervention to decrease maternal mortality in the US.
Thank you, Abby. For our limitations, there were 4 limitations that were identified. One was implicit racial bias against African American women, which creates limitations to establish health interventions. There was also a small sample size and lack of inclusion among Native American populations, and also a lack of inclusion regarding miscarriages due to lack of adequate obstetric care and educational resources available. Overall, we determined that there is just not enough focused research on the health concerns of rural US women. For our recommendations, we recommend collection of data from the perspective of women living in rural communities, especially qualitative data. Also, culturally competent care from a patient or layperson perspective should be addressed. And increased Medicaid spending may help to improve maternal health outcomes. So while maternal mortality rates have increased in the US, the rate has decreased in Medicaid expansion states. So there is a need for more investigation and data on the quality of care offered to rural mothers who use Medicaid. For our implications, due to the lack of maternal research available on rural pregnant women living in the U.S., global interventions can be used as a model for public health organizations to create and implement interventions for rural communities. Subsequently, interventions developed by local public health organizations could potentially provide exemplifications for global public health organizations to improve or create new international interventions. From our findings, there was a study that examined rural-urban differences in severe maternal morbidity and mortality in the US from 2007 to 2015. A national alliance was established called the Alliance for Innovation on Maternal Health, and this helped reduce severe maternal morbidity and mortality for minority women living in rural communities. There were also local policy implications from the study that indicated a need to increase planning and policy making and to have more representation of rural residents when developing these policies. From our findings, there was also a prospective cohort study on maternal health literacy progression, which depict how an educational program intervention contributed to the improvement of maternal literacy progression among low-income, high-risk rural perinatal African American and white women in the U.S. From our findings, there is an immense need for minority women living in rural communities to have access to quality maternal health care in the U.S. With the continuation of racial bias, limited maternal research, as well as interventions and resources, mothers living in rural communities will remain at risk for health outcomes such as pregnancy, complications, gestational diabetes, high infant mortality rates, and high maternal mortality rates. This concludes our presentation, and thank you for your time and attention.